For my assignment, I chose to research Doctor on Demand. Doctor on Demand is owned by Jay McGraw and Adam Jackson. Jay McGraw's dad is Dr. Phil, so doing doctor stuff runs in the family. Both men are 35 years old, and they started their company in 2013 in San Francisco. What is Doctor on Demand exactly? Well, I'm about to explain. It is an online accessible medical service for anybody that has access to a mobile phone, a computer, or a tablet, and they can go and chat with a doctor online without having to go into a medical office or sit in a waiting room. You get to video or live chat with certified doctors, psychologists, and psychiatrists. It is available 24/7 and 365 days a year for anybody that can't get into a doctor's office or works. It is free to sign up, and like I said, it's accessible by phone, computer, or tablet. How does Doctor on Demand work? You sign up for free online, or you can install the app onto a mobile device and use it on that. You get to sign up with or without healthcare. With healthcare, you can help pay for the fees later on, or anything like that they would need to use the healthcare for. You get to see a doctor right away in a video chat after you put in your symptoms, or you set up an appointment with a psychologist or psychiatrist for people with anxiety, depression, traumas, or anything like that. And the cost, like I mentioned before, there is a free sign up with no monthly or yearly fees, but there is a fee per chat. Each chat is a little bit different depending on who you talk to. With a medical doctor, it's $75 for a 15-minute consultation. And at the end of each chat, you get to choose if you want to talk for a little bit longer, and then they add a fee onto that. It's $79 for a psychologist chat for a 25-minute consultation. For a 50-minute consultation, you get to pay $119. For a psychiatrist, it's $229 for the initial 45-minute consultation, and then it's a $99 follow-up 15-minute fee. The improvements I see to healthcare with Doctor on Demand. It cuts down on waiting times, whether you're going to the emergency room or you're going to a doctor's office, so you don't have to sit there or wait in line or wait for a doctor to become available. Patients have the opportunity to see a doctor after hours, so people that work all the time or have kids and they can't get into the doctor's office, it gives them a chance to do it whenever they can, whether it's at 1 a.m. in the morning and something happens with their kid or anything like that. And as a person that works a lot and has to wake up at 5 a.m. to be able to see my doctor within a reasonable amount of time, and that someone that's waited in an emergency room for over 5 hours, it's a nice opportunity to be able to at least have that option, whether you use it or not. Doctors can help interpret test results from any kind of medical lab. If you go and get blood tests or anything like that, you can say, hey, this is my results. How do I understand this? Can you help me understand it? Doctors can also help with minor situations at home without having to make a trip to the ER or doctor's office. Moms that are breastfeeding can help, or moms that their kid fell down and hit their head, and just to like, hey, does this need stitches? Or hey, should I go to an emergency room? Do they have a concussion? It would help a lot, especially for parents with young kids. And it provides most of the same care that ERs and medical offices do. I've read in my research that they cover up to 90% of what an emergency room or medical office covers, such as UTIs, which is urinary tract infections. They look at cold and flu symptoms. They look at depression, anxiety. They look at a whole bunch of other different things that you wouldn't have to go to an ER or medical office. They wouldn't be able to help with breaks and setting bones and stuff like that, and splinting bones, because they don't have access to you physically. They can tell you, hey, you need to go and get this splinted or checked out or x-rayed, but they can't actually help you physically. My opinion in is this a good way or to do healthcare or to have improvements in healthcare? Yes, I think it's a great idea. Like I said, as a person who's waiting in operating rooms and medical offices and has to wake up super early in the morning to see my family doctor, it's a great option to have. But I have some reservations and some concerns and issues, like the cost. Sometimes that kind of cost for somebody that's in school like me, it's pretty steep. $75 for a 15-minute consultation when I can just wake up early and go see my doctor for free. It's a little bit of a stumbling block because if you don't have that money to be able to use it, then it's hard to get access to that kind of thing, especially if you need it in an emergency. But they also aren't able to give you continuity of care. So they can help you initially, but there's no follow-up. There's no, hey, how'd it go, or anything like that, because they aren't there in person. You can't just go back to them and go, hey, I talked to you about this. This is what happened, that kind of thing. So it's, my opinion is I believe it's a great option for a lot of people, but the prices of the chats with the doctors and the fact that they aren't there in person and can't connect with you physically and be able to provide that kind of care is something that would have to be worked with, or I would have to think about to be able to use this healthcare option. But I think it's a great improvement to healthcare in this century, and I think it could help a lot of people.